You've probably heard about low T. You see it on billboards and in advertisements. But low testosterone is not just a male problem. It can greatly affect a woman's life, especially as she ages. And here to tell us more about testosterone for both men and women is Dr. Jenny Wilkins from AgeVital Pharmacy. Welcome back, Dr. Jenny. It's so great to have you here. So let's start with women. I didn't even know we had it.
Testosterone, yes, it is the hormone, and they call it the sexy hormone for a reason, okay? Women, if you want to be swinging off the chandeliers, that's the way to do it, okay? And so a lot of women, as they get older, they start realizing, they're like, oh, wow, I just don't feel as interested anymore. They don't have that mental capacity to think, oh, I just want to jump my husband's bones, you know?
Right.
And the husbands always think, or the significant other always thinks, wow, they're just not interested in me, they're not attracted. But that's not true. It's this hormone, this molecule, this very simple hormone that actually causes us to say, oh my goodness, let's go. You know, it's like the reproduction hormone, you know, otherwise we wouldn't all be here, right?
Won't we grow beards?
Oh,
that would be a that would be
unattractive.
Yeah, no, that would,
You're
too much.
It up right now. Is that actually going to happen?
Well, if we had the levels of testosterone of Paul, then we would probably grow beards. But for women, you're talking 1 milligram, 2 milligrams, 5 milligrams, up to 10 milligrams of testosterone taken daily.
So we normally have it in our bodies, but it decreases over time.
As you age, our bodies are like cars, okay? You have to constantly maintain that car. If you don't put the gasoline in, it's not going to go anywhere, okay?
How do we know if we're running on empty? What are the tests for this?
Okay.
And did you bring any with you?
But I got a big tub in the back. We'll just bathe in it.
Paul, are you comfortable?
Just looking at camera 3 right behind. There it is. There's room for me.
Signs and symptoms include erectile dysfunction, weight gain, increased body fat, reduced libido for women, and even inability to climax, to orgasm. So there's a lot of women out there that actually fake this, but if you give them a little bit of testosterone in a cream format that they actually apply, it's a foreplay cream. We make a cream called the triple orgasmic cream, or the scream cream, or the dream cream.
And what it does, so it's actually administering the hormone into our body through the cream.
Yeah, and you could apply it. Men will apply it. We'll make like a deodorant stick, stick that they apply even right before the gym, you know, to give them some energy. Women will do it, in a little
Those
cream.
signs are scary.
Yeah, they apply it right on their wrists, and some guys like injections.
And is it like instant? Like
Oh,
you put the,
absolutely.
Really?
100% instant. All of a sudden you feel like a light bulb goes off in your brain. You're like, oh, wow, I'm alive.
And you really didn't bring any for us to
husband,
try?
come hither.
Okay, there've got to be some downers about this then. It can't be perfect. What are the downside of this?
Oh, there's always a downside. When it comes to hormone therapy, it's all about homeostasis. This is why it's so important to test. So you want to make sure that you have a healthcare provider, whether it's your pharmacist or your DO or your MD or your nurse practitioner or PA, actually looking to see what your levels are. So that's through saliva, that's through blood, and you have optimal levels for men, which are anywhere between 900 and 1100. You have mainstream, practitioners that say, oh, 300 is optimal. I'm like, no, 300 level, in a male, you might as well be a 70 or 80-year-old male, and you start to slunch over. If you see these little elderly men and they start to hunch like this, you give them a shot of testosterone, all of a sudden they start standing up straight again, they start building muscle, the skin, the hair starts growing back in. So a lot of men will think, if I take testosterone, I'm going to lose all my hair. Be like, no, that's actually not true. Testosterone actually makes your hair grow.
Of course, you're doing fine, so you don't need any.
Well, thank you for that. I was going to ask a question about how it all relates to the food that people eat, because biochemically there's a lot going on with the food that people eat.
There's so many synthetic metabolites in our environment. We're constantly bombarded by all the environmental toxins that affects our level of testosterone. It's almost like an epidemic. Everybody is deficient in testosterone because of our foods.
We are coming to see you, AgeVital Pharmacy, and of course this is check out agevital.com for more information. Coming up next, we meet Carl Remy from McCurdy's Comedy Theater. He's going to make us laugh, I promise you. You made it.